Good afternoon, Mr. Ames. How are you?
I'm good at you.
I'm doing well. My name is Joelle. I'm going to be your nurse today. Have you had a persistent cough all day?
Yeah.
Yeah, would you like some water?
No.
Okay. Well, Mr. Ames, like I said, my name is Joelle, and I'm going to be your discharge nurse right now. I'm the oncoming shift. I do see that we have a couple of things we need to address before. I'm sorry. I do see we have a couple of things we need to address before you go home today, such as educating to see where you're at. And, I know that you're not feeling comfortable taking your shots with the diabetes, so we're gonna see what we can do with that. And we're also gonna have therapy come in, physical and occupational therapists come in today to make sure all of your limits are needed. All the stuff you need to be discharged are needed. Also, I'm sorry, this is a lot, I know. And the gaps that are there, we're also gonna have management come in to replace that so that when you get home, you're comfortable and we can address everything. Okay? So I'm gonna do a quick assessment right now. Can you confirm your name and date of birth for me, please?
January 1947.
Okay. Sounds about right, yes. And your name?
Ames.
Ames? Okay, thank you. So I'm just gonna check your lung sounds really fast because I see that you're coughing a lot. Okay, can you sit up for me a little bit or?
Oh, my leg.
It sounds a little clear, maybe you just have a little bit of a cough. Okay, I'm gonna look at the leg really quick and then I'm gonna have the physical therapist come in as well as the occupational therapist, and we're gonna target all of those matters. I'm sorry. The wound is healing rather well. So can you tell me how you take care of that?
Huh?
Do you know did they teach you how to take care of it? Okay, well, I'm gonna call the wound specialist. Okay, so I'll be back for you, Mr. Ames.
Hi.
Hi, I'm Mr. Ames. Hi, my name is Shauna. I'm the dentist here at the hospital.
Oh.
Okay. Could you just verify your name and your date of birth for me, please?
Ames.
And your date of birth?
January 1st, 1949.
Okay, thank you. All right, so the reason why I'm here today, like I said, I'm the dentist. I want to make sure that you have good oral health. Okay, and I know we went over some things previously. I'm just gonna do a quick exam. Could you open up for me, please? Good. Close your mouth. Okay. Good. Your gums look good. Okay, Mr. Ames, I know I already discussed with you, but I want you to just show me how you brush your teeth when you're at home.
In a circular motion.
Okay. And we're aiming for the back also, right?
Yeah.
Everywhere. And then also keep in mind it's important to brush your tongue also. And don't forget your gums because we want to prevent gingivitis, okay? And make sure you always want to floss in between, and you want to use our mouthwash also because we want to get rid of all the plaque after eating, okay? All right, now is there anything else I can help you with? No? All right. Well, I'll be back later on, but I'll see you soon, okay? Okay.
Hi, good morning, Mr. Ames. How are you?
Good at you.
My name is Lizzie.
Hi.
I'm the respiratory. I know that the other respiratory, Lourdes, showed you how to use your CPAP, correct? Okay, but I'm here to remind you, and I want to make sure that you know how to use it, so just practice. So you're always going to get your CPAP. You're going to put it on a level surface, okay? And you're going to connect the tubings. And remember, we're going to use distilled water when we use the water. And we're going to make sure that your mask is always adjusted. She showed you how to use it, correct? Okay, so we're going to, if you by any chance have any leakage, you can use the straps to readjust it. And also remember that in the morning when you wake up, you're going to make sure to watch the mouthpiece, okay?
Good morning, Mr. Ames. How are you doing today? Okay. My name is Tara. I'm going to be your occupational therapist today.
I'm Marissa, I'm going to be your physical therapist today.
And I'm just going to teach you some simple exercises with your arms to help strengthen your arms back up because we know that you've been through surgery. And, we need to get you up and going.
I don't want to fall.
You know what? And we're here to make sure that you don't fall. And we're also here to help you to gain back your strength and your confidence in everything that you're doing. It's gonna take some time, but we're gonna get there, and we're gonna take some slow steps to get there, okay?
Okay.
All right.
I don't wanna fall though.
No,
You're not gonna
I'm here to help you transition from the bed to the chair, so you're not gonna fall. I'm gonna teach you easy methods, so you won't fall. And we'll do supportive exercises as well for your healthy leg.
Okay.
Now, do you see this bar that's right above your bed?
Uh-huh.
Okay, so with your hands, one at a time, we're just gonna reach slowly to touch the bar. And then I'm gonna want you to grab the bar and just pull yourself up a little bit from the bed. Let's see how far you can pull yourself up a little bit from the bed. And then you're gonna lay down, okay? And then I also have your water bottle that's here. And I'm gonna be asking you just to reach over to grab the water bottle to also see how far we can get you up from the bed, so you're not always laying flat on the bed, okay? Because we don't want you to get any ulcers on your back or in your arms. We want to get you moving as soon as possible so that your discharge is smooth, okay? All right, so let's get started, okay?
Okay.
All right, so first, can you reach your right hand and grab the water bottle for me? And while you're reaching for that, I want you to pull yourself a little bit forward. Let's see how far. All right. Now I want you to take your left hand for me, Mr. Ames, and I want you to do the same thing again. Try to pull yourself up a little bit. Oh, good job. Slowly but surely we're getting there. We're getting somewhere, okay?
Just as long as I don't fall.
We're not gonna let
We're
you
not gonna
fall.
let you fall.
Alrighty?
Okay, Mr. Ames, so now I'm gonna help you try to transfer to the chair, okay? So what we're gonna do is, I already lowered the bed to the lowest position possible. I'm gonna raise up your bed a little bit higher for you, and then we're gonna wiggle you this way, facing towards me, and you're gonna hold tightly on here while we adjust the chair, and we're gonna both help you to the chair, okay? And then also, the stocking that goes to your stump, the wound care nurse is going to bring it. And after that, after she assesses your wound, I will come back and show you how to use it. It's very important that you put it on, okay? It's for circulation reasons as well. All right, and we promise we're not gonna let you fall. I'm gonna show you an easy method to do it. I also wanna see how strong your good leg is. So let me quickly press against here. Hard as you can, really hard. Oh, there you go. So you're pretty strong on this leg. So this is gonna be your base leg.
Athlete.
All right. So now we're gonna get you onto the chair. So this is the wheelchair. Okay? I'm gonna put this here so your stump is not resting on the. And we're locking it so it doesn't slide so you won't fall, okay? All right, so we're gonna raise you up a little higher. Oh, are you okay? I know it's a little numbing. All right, so now we're gonna move you over, okay?
Come in.
Okay, Mr. Ames, how are you?
I'm good.
Okay, so I know that the physical therapist came to see you, our occupational therapist, our dentist came to see you, and also I know that the respiratory therapist, and we added a couple others in there.
Hi, how are you?
Oh, I'm good, and you?
My name is Nicole. I'm the case manager here on the floor. Are you Mr. Ames? Okay, let me just see your first one. Okay.
She's gonna be addressing some of the other issues that we wanted to target, and also we came up with a plan so we could target keeping things in memory and in track, okay?
So basically, how are you doing so far? What's your pain level?
8.
8? Okay, so pain. The good thing is that we were able to speak to your physician and have them call in the new meds for you. So it's pain effective and cost effective, so hopefully it will help you because the dosage have been increased because you're still at an 8, right? Okay, and we were looking over your file and we were thinking that maybe you might think about going into ALF because you might need help at home. Is that true? Do you have some concerns and some fears that maybe?
I just don't want to fall.
Okay, so what we're gonna do is we're working to get a home health nurse to probably come in and see you and have a social worker on the case right now so that they can kind of discuss details of what's gonna happen when you get home, okay? You have any questions at all? Okay, I'm gonna come back and provide you with a book of different resources that you can go to. Please feel free to always call. We're gonna follow up with you once you get home, okay?
Also,
Okay.
Mr. Ames, just so you know, for the long-term effects, we did target having a therapist for you, having the home health, as she said, and another specialist that's gonna come in and talk to you, okay?
Okay,
Thank you.
all right, see you later.
Thank you. Bye.